Okay, good evening, everyone. Happy new month of July, and welcome to ATP Live Monday. I am Bimisela Boyde, and it's my pleasure to be here today. ATP Live Monday is a program brought to you by Ask the Pediatrician's Foundation, where you get to ask any questions that you may have about the health of your children and get immediate answers live from a pediatrician. So I hope you have any questions, feel free to ask them. And thank you so much for joining me, whichever platform you're joining from, on Facebook, on Instagram, on YouTube. You're welcome. So I'm just going to for share the video as usual. So also encourage you to share the video as well. Just help us share so that other people can see and they can hear. All right. So let's just do that right now. So I'm just going to go to my page and then share the video, and then we'll start after that. Joining us yet? Okay. Welcome everyone. If you're there, just let me know you're there so I can. Right, I'm just trying to see. It's my live video. Okay, let's open this one. Okay. Okay, I just see. Welcome for those who are joining us on Instagram. Grace page, welcome. Um, I'm just trying to share the video first so that people can see and they can hear us. Okay, and then let me also share. Okay, let me pin it as well. Okay, and then let me change to my page. Okay. Okay, I'm just sharing this one. Okay. Okay, I think I'm done with all the sharing. So good evening, good evening. Okay, let me do all the pinning. I'm always forgetting. Sometimes you forget the sharing and then you do the pinning. I think I should just copy the link. Okay, let me go to. Okay, all right. So good evening, everyone, and welcome to ATP Live Monday. How has your day been? I hope you've had a lovely, lovely day. Today is the first Monday in the month of July. And of course, as you may have seen, July is Ask the Pediatrician's anniversary month. So I hope you will join us and celebrate with us. So thank you so much. So that will be 11 years since we've been online doing a lot of health education, information, and even beyond online, we do a lot of medical outreaches as well. So it's good to be here. So if you have any questions about the health of your children, this is the time for you to ask your questions, and I will do my best to answer them in the next one hour that I have. But remember that even beyond the live session, you can always post your questions on our Facebook group and we will be there to answer them. So feel free to ask any questions that you may have about Ask the Pediatricians Foundation and also any question you may have about the health of your children, and then we'll try and answer them as soon as we can. Thank you so much for joining us. If you are watching from um, if you're watching from our Facebook page or you're watching on our YouTube channel or you're watching on the um, uh, Instagram page, you can just drop your question directly underneath the video and then we'll be able to answer them straight away. But if you're watching on our Facebook group, you may need to click on the video so that we will be able to see your questions. But if you're watching on the Facebook page, that's fine because we'll be able to see your question anyway. So thank you so much to everyone who is joining me. I know some of you or if you're watching the re-recording later on, that is also fine. So thank you so much for joining us. All right, I can't see any question yet, so I'll just while I'm waiting for the questions. Oh, somebody, okay, there's somebody on Instagram. Tare Caroline, thank you so much for joining us. You are trying to ask a question about your 5-year-old son. Okay, so just go ahead and complete the questions, and I will try and answer them as soon as we can. All right. So I'm still waiting for your question to be complete. All right, and then this time is the I think it's like raining right now in Nigeria quite a lot. Apologies to those who have been affected by the flood. I saw a lot of videos online, especially in Lekki and the rest of the place. Please keep safe, keep our children safe as well. All right, so Tarek Caroline is saying my son is 5 years old and has changed his milk teeth, but it's been more than a month now. The new teeth hasn't come up yet. Okay, very good question. Children are some children are not born with it, so they usually bring out the milk teeth by 5 to 7 months. However, some children are born with it as well, so we have what we call neonatal teeth, and so we try to remove those ones anyway. However, after from 5 to 7 years, that is when the children begin to drop they begin to lose their milk or primary teeth, like we call it, and then they begin to develop new teeth. However, it is not always automatic, so it's not always that immediately the old teeth are falling out, that the new, and usually all of them won't come out at the same time. I don't think the child would have changed. The child is not going to lose all the 20 milk teeth at once. So I guess maybe it's one or two of the milk teeth that has fallen. So your child has not lost, I believe so, but you can correct me if I'm wrong. So the new permanent teeth to replace whatever has come off will come back. Sometimes it take up to 6 months. Sometimes it can even take up to a year before they come back. It's a range of time. The time for it to come back is between five. So from age of 5 to 7 years, that is when the children are losing the milk teeth and having it replaced. So it's not always automatic. I'm sure you remember there was a time when you see children and you see those gaps in their teeth, and people used to make fun of them. So that shows you that it's not automatically that the teeth comes off, that the new one will come back. So you just relax, it will come back. Usually we still give it 6 months to 1 year. But if you are so worried about it, you can see the dentist, because the dentist can always take a picture for you and they will show you the permanent teeth inside the gum, and eventually they will come out. So it's nothing to worry about. Just give it a little bit more time. I think the most important thing now is for you to just continue with the oral hygiene, making sure you're brushing the teeth regularly, and eventually it will come up. Okay. I hope that is okay. If you want any further clarification, Sari, feel free to ask the question. All right. Coming back to Facebook, I got another question from Cynthia. Uh, Maria Bay. Okay, so I hope I pronounced the name correctly. If not, apologies. Say good evening, doc. My 11-month-old baby is not crawling, only sitting. Please, what can I do? All right. Thank you, Cynthia, for joining us, and thank you for your question. Again, it's one question that people tend to ask the pediatricians quite a lot. However, I'm happy to reassure you that crawling is actually something we worry about as pediatricians, because the truth is some children never crawl. Some children don't crawl at all. So we are not worried about crawling, because we know that some children don't crawl. They will just go from sitting to standing and walking. Or some children do what we call bottom shuffling. So instead of going on all fours and crawling with their hands and legs, they just move with their buttocks. So they just, shuffle with the buttocks, and that is also fine. So that's one of the normal variation. So crawling for children that crawl, most of them is around 9 months, but we know that some children don't crawl. Some children will bottom shuffle, and then some children will not even do either. They just go from sitting to standing. So you don't need to do anything. You don't need to do anything at all. Just leave the child alone, and you can just, as long as the other aspect of the developments are fine, you don't need to worry. Is your child already trying to hold something to stand, like, and or move, holding onto the table and walking around the table? If the child is doing that, that is cruising, and that is absolutely normal. That's expected from about 11 months, 1 year. Though some children will be a little bit later doing that as well, but it's nothing, absolutely nothing to worry about. Just to remind us that for some of these topics we're talking about, we actually have written about them. So if you go to our website, www.askthepediatricians.com, you can read more in detail. So for Tara Caroline, we have an article on or I think I had an article on teething and what are the normal teething milestones. When are you supposed to see each of those teeth and time? So you may want to check that up as well for more details if you want to read more about it. And also for Cynthia concerning crawling and developmental milestones, we actually have an article on is your child's development okay Okay, I'm happy to say your child is already standing and cruising with furniture. So that's absolutely lovely. So that means the child's development is fine. Some children don't crawl, so you don't need to worry at all. So if you want to read more about milestones, you can also check our website. There's an article on is your child's development on course. Is your child development on course? That will give you that information. We actually have put there what are the time and what are those things that your child is not doing that we want you to start coming to see us. So, because a lot of time parents worry about everything, and that's because we are comparing the child to other children around the same age, maybe that we give birth to at the same time. So it is completely natural and it's completely normal for us to do that as parents. But we as pediatricians, we have a lot of gaps and lots of rooms, lots of variation in terms of when children achieve different milestones. But we've written an article that tells you when should you be worried, when will a pediatrician be concerned about your child's development? When do we want to see the child? So if you are interested in that, I will recommend you read that article about child is your child development on course, and we've put there the big ones, the time where you should come and see us. So for example, if your child is not walking by 18 months, definitely we want to see the child. So 18 months is our own cutoff. That's when we begin to worry. If your child is not talking by 2 years, obviously want to. But there are many more other in between. I'm just giving you examples of the big one, because even though when we say this is the average time, some children will be very fast and do it quicker than the average time. Some children will be a little bit slower, and do it a little bit after the average time. But there's always what we call the cutoff age or cutoff time when pediatricians we are now really worried, and that's the time that we want to intervene. But if your child is already cruising at 11 months, I'm absolutely not worried. And I think the child may just be one of those exceptions that don't crawl at all and they just, walk by themselves. So thank you so much. I hope that is clear. Okay, coming back to Tari Caroline. Okay, you said thank you, Doc. So I believe that means you are happy with the answer to the question. But just to remind you that the dentist actually wants to be seeing your children from the age of 1 year. So if your child has, I know it's not something we do regularly, it's really in Nigeria, in Africa, but the dentists want to start seeing our children from the age of 1 year, and they will see them every 6 months. Doesn't mean there's any problem. They just have to do regular checks. Um, they just want to do regular checks on the children's teeth. So if you are able to take them for that check, I'm sure that would be lovely. Okay, I hope that is answering the question. Right. Okay, I see. I don't have any questions now, but I'm just going to see if I can. Okay, no questions yet. Okay. So while we are waiting, I was talking about the issue of floods that is going on in some parts of Lagos right now, especially in the island area. And we need to really watch out for our children at this time because children can easily drown. And so please, if you live in those areas, watch out for the children. We also need to pay attention to our water supply at this time because those water can easily become contaminated. So let's make sure we are boiling the water, or if you don't want to use boiling method, you can use chemical sterilization. So like water guard and all those that you can apply to your water to sterilize them. It's very important. Children during this period when there are flooding and all that, there's a probability of things like cholera epidemics happening. We don't recommend cholera vaccines for children. I know some private hospitals give it, but the most important thing is to pay attention to hygiene. So pay attention to washing our hands, pay attention to boiling our water, pay attention to cooking our food. Preferably, let's cook our children's food for them. Let's not, patronize food vendors because the risks of cholera outbreaks is quite high during such periods. And of course, children go to school, so it's either the school is giving them hot meals that they have their own vendors, or we are packing the food. And packing food, we really need to be careful because if you put them hot food very early in the morning in the coolers, they can easily get contaminated by bacteria, which will multiply, and that will put the children at risk of food poisoning as well. So packing food, we have to actually either pack sandwiches, cold lunch, things that can easily preserved, or we preferably the children should eat their food in school, odd meals prepared for them at school. So that's just what I would like to talk about in terms of what is going on currently in the country, actually for those of us who live in Lagos. All right, but for those who are just joining us, you're welcome to ATP Live Monday. I'm being celebrated pediatrician here for you. If you have any questions about the health of your children, I got about 40 minutes left for you to ask your questions and I will answer them. And for those who may just be watching this as a recorded video, maybe you are not joining us live, you're also welcome. You can watch the video to the end. And if you have any questions, feel free to go to our Facebook group, Ask the Pediatrician Facebook group. We're there Mondays to Saturdays. You can post your questions, and one of our moderators, one of our professionals, will try and answer your questions as soon as we can. Please be patient with us. But just to highlight that if a child is sick, a child is very ill, please take those children to the hospital. Them online. I did see a video of a child who was having difficulty with breathing, and mom posted the video and was asking us. Of course, we gave the answer. But such kind of children, for example, should have been taken to the hospital. I know mom has been to hospital and the doctors have reassured her, but when you get home and the child is not better, the child is now even having fast breathing, difficulty with breathing. As a mom, just go with your intuition. If you think your child is not better, it's always okay. We are happy for you to come back to the hospital, and we can sometimes readmit the child and then we can treat the child. So feel free to always take sick children back to the hospital and then for the doctor to see them. Okay. Um let me just check whether I have any question on Instagram. Okay, no question on Instagram, but Adepeju and Tife Ojoko, you're welcome. Thank you so much for joining us. Uh, today. All right, and then so just to reiterate, what are those things that will make you? What are those conditions children will have that is an emergency, and you have to take them to the hospital? I know I started talking about it sometimes last. A few months ago, but I don't think I finished that. And usually, in medicine, we have what we call the ABC. There are conditions that anything that affects the hair, and A stands for the airway. If the child his airway is blocked. The child has choked on something. The child is not able to. Something is blocking the nose or blocking the airway. That is an emergency. That child needs to be taken to the hospital. If the child is having difficulty with breathing, so which brought me down to the video I saw on our Facebook group. Anything affecting the child's breathing, breathing difficulties, breathing very fast, breathing so noisily, in a child who is otherwise well before, that child really also needs to be taken to the hospital. Or if a child is bleeding, so a child who had a fall, a child who had a cut, and it is really bleeding, that child needs to be taken to the hospital. If a child has burns, because sometimes we have to be very careful with our children during this period, and sometimes ideally I always say let's not allow children in the kitchen at all. Let's just keep the children completely out of the kitchen. So, but if accident happen very fast in split seconds, and children has hot water pouring on them, hot oil pouring on them, any child who has burns is an emergency. You need to take the child to the hospital. Also, our very young babies, like our 0 to 2 months old babies, any health issues in them at all, we always classify it as urgent and we always want to address them on time. So that is that. Let me just quickly answer Cynthia's update. Say thank you, ma'am. A friend of mine told me to buy drugs that it will help its bond. Okay, number one, don't buy drugs because your friend of you tell you to do that. And I'm speaking for all the parents who are listening to me. Please, drugs, medical issues are not things that we take advice from people who are not qualified to advise us. We don't joke with the health of children. And that's actually one of the reasons we have asked the pediatricians. We want you to ask the people that are qualified to advise you on health issues. Your friend, I'm sure, is not a doctor or a nurse, so it's not appropriate for them to be telling you to buy things. And then people sometimes don't know what is normal. I know sometimes people may have had experience, maybe they have that particular experience, and because they had that experience, the doctors or the nurses told them to do something, they just want to copy and paste. No, health issues is not copy and paste. You can't copy and paste because things may look similar, but they may not be the same. Okay. And, there are differences, maybe the age, there may be differences in terms of the circumstances. There are many things doctors think about. There are many things we look at, but obviously for parents, you're only looking at, oh, this child is not crawling, and the doctor said go and buy vitamin D. Number one. Number two, your child crawling or not crawling is not a bone issue. It's not a bone issue, it is a brain issue. When we're talking about development, it's not the bone, it's not the muscle, it is the brain, okay, that is involved when it comes to development. So this child does not need to be given vitamin D because the child is not having any problem. And there's even nothing wrong with your child. Your child development is age appropriate because, like I asked you, is your child cruising? Your child is already cruising. But you see, ignorance is quite common, and when it comes to health issues, ignorance can be costly. So that is why you have us on social media. You have the pediatrician to ask. Honestly, this is actually the reason why we started ATP 11 years ago on the 20th of July 2015. So I know what you're talking about. Actually, I come online and I see parents doing exactly this. People will come and say, "Oh, my child is having this issue," and people will start giving them advice. And some of those advice, frankly, they're coming from a good place. People are being sincere. They want to be helpful. But when it comes to health issue, it is not a democracy of opinion. It is either there's right or there's wrong. You can't just say, I see mothers getting more confused because somebody has asked a question and they has gotten 10 or 20 different answers. And some of those answers are poles apart, and the person is left more confused than at the beginning, than at the at the end, than at the beginning. So it is one of the reasons I felt parents should have a platform where they can actually ask the professionals. Because, and I keep telling people, if there's an issue with my car, I'm not going to ask my tailor about my car. That is the truth. And I don't know why we think for something more important when it comes to our health and the health of our children. What we won't do with things that I can easily replace, like if my car got knocked or whatever happened, I can always get a new car, but I can't get a new child easily. Okay, at least even if I get another baby, it won't be the other baby. So things that is more important, we sometimes a little bit careless about it, and we just give advice anyhow. But nobody takes advice from a fashion designer if anything is wrong with their car. So if my fashion designer tell me to go and put salt in my car, will I do that? I won't. But if my mechanic tells me to go and do that, yeah, I'll do whatever my mechanic tells me to do because I know that the mechanic is an expert when it comes to car. The same thing. But and that is even things that, okay, even if they make a mistake, I can always find an alternative, get a new one. But when it comes to health issues, mistakes or wrong information can kill. It is that bad. So, and that is one of the things I saw on social media that make me think, no, parents must have a place where they can get reliable information. So I always say, parents, don't take health information advice from people. Even if they give you advice, thank you, cross check it first with your doctors and your health professionals, cross check it with your nurses, okay, so that you don't do the wrong thing. So there's no basis for your friend advising you to go and buy drugs And even worse is when people even give drugs as souvenirs to children. People say, oh, somebody went abroad and they brought me these vitamins or these drugs. Should I give it? No, don't. All right. We don't just give drugs anyhow to children, and we don't just give people advice anyhow. And especially when it comes to buying drugs, no, that is absolutely unacceptable. So I've already given you advice. I've already told you there's nothing wrong with your child, and I've already told you you don't need to do anything. So you don't need to take advice from somebody who is not qualified to advise you on health issues. Okay. Your child walking, crawling has nothing to do with bones. It has to do with the brain. Okay. So that is just I thank you for asking that, because that gives me an opportunity to give more information around that. So don't buy 7Cs, don't buy liver oil, calcium, vitamin D. Don't. And one thing you need to realize, there are some what we call fat soluble vitamins. They store in the body and they can be too XX. Okay. If your child is eating well, your child is playing, running around in the sun, they are going to get all their food, all their calcium, all the vitamins. They're going to get it from the food. They're going to get their vitamin D from running around in the sunlight and playing. So you don't. Your child is cruising around. Your child development is age appropriate. It is ignorance to say, okay, if a child is not crawling, that means something is wrong. Something is wrong. Some children don't crawl. That is normal. So that is the advantage of when a health professional is giving you advice versus somebody who does not have that information and that knowledge. So relax, don't do that. But I just use that as a teaching opportunity, because people do that a lot. And if you're also one of the people who do that, those who are listening to me, please stop. It is wrong. Don't ever advise people to go and buy drugs or this or that. No, don't. You are not qualified to do that. And you may mean well, but you may cause more harm. And don't copy and paste drugs. Even parents do it. Okay, last time I went to the hospital, my doctor gave my child this. So another child is coughing. I'm just going to go and copy and paste. No, don't do that. It could be something completely different. We have like maybe 20 different causes of cough. So how do you know whether this particular cough is due to infection or this one is due to asthma? But you're going to copy and paste the drugs that we give for somebody who has infection, for somebody who has asthma, and the person can die because if you don't treat it on time. So health issues is so important. We cannot be leaving it to chances, and we cannot and I take that responsibility very seriously, because I get a lot of DMs and inbox from parents who have lost their children, and have whipped with complete strangers online that I don't know before. But so this is something really important to me. This is something really I'm very passionate about. I don't want parents to get the wrong information, and I don't want them to do the wrong thing, and I don't want them to end up having lost their precious children. So if you cannot take advice from a tailor about your car, or from a barber about your clothes, don't take advice about the health of your children from people who are not qualified. It's very important. Your children are even more important than all those other things I've mentioned. So thank you for giving me the opportunity to reiterate that teaching as well. All right, let's move on. Rita, saying good evening, though. My 8 month has no teeth. Okay. She was born at 32 weeks in October. Okay, that's a very good question. Number one, again, so when it comes to children, we have a lot of variation. So I was telling, I think Tara Caroline on Instagram, baby's teeth came out and she's worried that the new one have not come back. However, it is, and I was saying that baby starts bringing out the first set of teeth by 5 to 7 months. Now, for your baby who is a preterm baby who was born at 32 weeks, we first have to correct your baby's age. So your baby's corrected age is actually 6 months, okay? Because the baby was born 8 weeks earlier. So I'm going to subtract those 8 weeks from the current age. So your baby is 8 months old now. We are going to take away 2 months. And that's so your baby's corrected age is 6 months. So anything I want to talk about in terms of your child development, I'm going to use the child's corrected age, not what you call chronological age. What you just gave me, chronological age, is based on the date of birth of your baby. But because your baby was born premature, I have to correct it and calculate what we call the corrected age. And the corrected age for your baby will be 6 months. So good. And then I already said that babies start to bring out their first set of teeth from 5 to 7 months. So your baby don't having teeth is still within normal because your baby is still within the age 5 to 7 months. So I'm not worried. That is the first thing. So you don't need to worry about it. But even then, when I even say babies bring out their first set of teeth by 5 to 7 months, we also know that some babies will not do it until 1 year here. So we have seen 1 year old baby with no teeth. And I always say parents, don't worry. I mean, your baby's teeth will eventually come out. Don't panic. I'm not sure you've seen an adult without teeth before. I mean, like not the elderly people that have now lost their teeth and have dentures, but most people will eventually have teeth. It's only very rare uh genetic conditions that will make people not to have teeth at all. So your baby will have teeth. You don't need to worry. You don't need to panic. So it's a wide range. Most babies will start bringing out their teeth by 5 to 7 months, but some babies may not even do that until they're about 13 months old. So that is our normal cutoff. But the dentist want to see your baby anyway by the age of 1 year. So whether your baby have teeth or not, once they are 1 year old, please see the dentist. So Rita, no need to worry. All right. Okay, let's go on to the next question from Abisola JJ Lola. You said, good evening, Dr. Bemi. 3 months ago, I bought my son's hair for the second time, and 9 months, his hair is not growing equally. The hair length in front is longer than the other part of the hair. Someone suggests I get vitamins for him. I want to ask if it's something to use vitamins for or not. Okay, thank you, Abisola, for that question. Number one, I want to know, when you barb the hair, did you barb it like it was even, like did you make the front bigger? You know what I'm trying to talk about. We all barb different styles for our babies, so some of us already left the front hair, or did you make it like a skin cut, like there's no hair left at all? That is the first question. If you, when you barb the hair, you already left the front to be bigger and the back lower, I mean, that is normal. Then that's the front part will be big, will be longer than the back. So I don't know whether that is the scenario here. If you are still listening to me, you can let me know what the scenario. But if it was a skin cut and some part of the hair grow longer than the other part, I'm not going to worry about that unless you are trying to say some parts are not growing at all. So if it's longer than the other, as long as all of them are growing, it's a matter of trimming them, making them equal. But if it's like, with what you are trying to say, because sometimes I try to understand what parents are trying to say beyond what they wrote down. But if you're trying to say that some parts of the scalp are not growing at all, like there's no hair there, then yes, I can understand that. So, but just to also know that some children, there's what we call the natural cycle of hair, and sometimes children can lose hair in certain parts of the scalp. And I'm sure some of us have seen children. It's very common, you see children, they will have their hair, some parts of it will have there will be no hair there, and some parts will have hair. If somebody was calling it free barber for me the other time, I don't know what people call it locally, but basically it is normal for that to happen sometimes, for children to have part of their hair growing in some parts, and I mean on the scalp, and some part of the scalp completely not having hair. Again, it is a normal variation for this age group. I don't know how old your baby is. Can you tell us the age of your child? Please remember to always put the age of the child, but usually for children below the age of 1 year and so, that we can have that scenario, and it's nothing to worry about. I always just tell parents, if you're happy with it, fine. If you're not happy, just barb the hair. If you want it to be equal, just barb it and make it equal. It's not something to worry about. So, and then another thing, we need to check the scalp. Are there rashes on the scalp? Because sometimes there are scalp rashes. The child may lose hair. Or some children have cradle cap. Some children have some other rashes on the scalp that make them to lose the hair. So that can also happen. But if the scalp itself is fine, there's nothing else wrong, and the hair itself is normal hair texture, the hair is either black or whatever color of the child's hair is, and it's strong, we will not worry about that. So I think what worries us as pediatricians is when the hair is either not growing because there's some like, for example, ringworm on the hair, or there's some other rashes on the scalp. Those are the things that will make us to worry. So because we need to treat that. But if the scalp is fine, then we may just take it as one of those natural. There are what we call reason why children can lose hair. There are lots of them, but there are some of them is just normal hair circle, and eventually when you cut that hair, when it will grow up again, the whole thing will be uniform and it'll be fine. Sometimes some children can have some deficiencies like copper deficiencies, malnutrition, especially if the child's weight is not age appropriate, and that can also make the hair, usually the hair will be thin, and then the hair will be brownish. So that is what we see in malnutrition. So if your child's hair is not looking thin and brownish, I will not worry about it. So, but if the hair is normal, but it's just that some parts are growing, some parts are not growing, sometimes that is just a normal variation, and I will not worry about it. But because I'm just trying to make a lot of assumptions. The best answer to this question is for me to see it. If you take a picture of the hair and send it to us, the hair, I can quickly make a little bit of look at the hair and decide, oh, this is just normal variation, or this something is going on here. So if if that is something you're happy to do, you can take a picture of the baby's hair and scalp and post it on our Facebook group. Unfortunately, on social media, on this live platform, you won't be able to post a picture. It's only allowed for text. I don't know why, but that is how it is structured. So you'll be able to post a picture, but feel free to take a picture of it and post it on our Facebook group and say, okay, I asked person on Instagram, ATP Live, and this is a picture. I will remember, because usually I will see any post that has a picture, I see them. So I'm going to be able to answer the question. But I'm not really worried. You've not told me the age of the child, but if it's an infant less than a year, some of this bobbing hair and hair growing, not looking uniform, is a normal variation, and it's something that eventually, as the children gets by 1, 2, their hair will now become uniform. You don't need to worry about it, unless there are other things on the scalp, and then you can see us and we'll tell you what to do. All right. Okay. So, Cynthia, thank you. I'm happy. Oh, Emilia, thank you for joining us. I'm happy. I'm always happy to see you because you are the consistent person who joins me from YouTube. Because most of the time I feel my YouTube is completely nobody's there, but I'm always happy because at least you give me that assurance that we should keep the YouTube page open, and because somebody is joining from YouTube. Yeah, it's nice to have you here. So you gave birth 2 weeks ago. Oh, congratulations. You're welcome. Okay. So yeah. Is it, did you ask about this baby the other time, or this is another baby? I can't remember now. But anyway, let's just you say, is it normal for my newborn to be pooing like 10 times a day? Yes, absolutely normal. So newborns can poo up to 12 times a day normally. And the poo is, you say it's oily and egusi like sun more like normal. Oily, are you giving something like, you giving like vitamin drops, or you giving something? I don't know where the oil is coming from. It shouldn't really be oily. You should, yes, egusi soup like, yes, that is normal. 12 times a day, normal. But I'm not sure where the oily part is coming from. But I know a lot of mothers do give some things to their babies as vitamin drops, and some of them, yeah, like some of those vitamin drops have oil, or you're giving vitamin D, or vitamin A, most of them have oil in them because they are oil soluble vitamins. So that could be the source of it. But otherwise, I'm not expecting the baby stool to have oil unless you are giving something else. And you know what? The only thing we want you to give the baby is breast milk. Okay, just breast milk. Just breast milk only. Everything the baby needs is in your breast milk. Unless you're living in places those who live in the UK or other parts of the world where the mothers tend to be deficient in vitamin D because they have so much of um, what do you call it, the winter and very short period of sunlight in the whole year. So sometimes they give their children vitamin D supplements, but most of us in Africa, and we don't recommend that. We just say exclusive breastfeeding. Your baby is going to get all the vitamin D from you, and that is it. Okay. I also have another question. Yeah, go on. How long does it take for circumcision to heal through the ring? Okay, it fell in 5 days. Yeah, also, honestly, that is a placebo. So there are two different methods of circumcision. We have the traditional surgical method where they will do an operation that's cutting and bleeding and all that. And then you have the placebo method, which is the plastic method, which is the one I think your baby had. That once the plastic drop, that is it. There's nothing like healing. It is healed already. Is you just bath the baby normally. You just dress the baby normally. You don't need to do anything per se. So that is it. So once the plastic has fallen, everything is done, and that is all. You see a tiny flesh by the side. I'm not quite sure what you mean by the tiny flash. Normally, I don't know what you're saying, so it's a little bit tricky for me to answer. But you know what? I won't worry about it. But maybe when you go for your baby's next immunization, like 6 weeks immunization, you can show the doctor. But as long as your baby is not bleeding, and there's no like pulse or anything, blood coming out from that thing, just leave it alone. Just bath the baby normally, wash the genitals the same way you wash the rest of the body. You apply the cream or the Vaseline, whatever you're applying, the same way you apply it to the rest of the body. And that is it. So for placebo, you're just good to go. Once it's dropped, that is it. There's nothing else to see. There's nothing else to do, and there's nothing to worry about. It is completely okay from day one. That is the advantage of Plastibel, unlike the traditional one that you have to be dressing, applying oil, and all those dressing. No, for Plastibel, you don't need to do nothing. All right. So, but don't do anything about it. Just leave it alone. When next you see the doctor, maybe just something that just needs to be trimmed off or just left alone, and I won't worry about it really. All right. Yeah. Okay. Okay, yeah. So you say it is even haircuts equally at the back, no hair. Yeah, okay. So this is Abisola's question about the hair. So I have a feeling I have an idea what you're talking about. Where children, I think that what I described earlier is actually what you're also describing. That is normal for some children. It's just part of the natural hair cycle that when you cut the hair, some parts will grow, some parts will not grow. But there's nothing absolutely wrong with that part of the scalp that is not growing. Again, it's just a face. It's just a face. And I'm sure if you look at most children's pictures, some of them always have that part where the back of the hair also, or a line on the back is completely bereft of hair, and the other parts are full of hair. It's a natural variation. And the other hair is fine. I won't worry about it. If it really worries you, I will just separate, because some parents are worried about the cosmetics and all that. You can cut the hair again down, and like I said, after a while it will grow, and it is completely normal variation. It is nothing to worry about. Okay. All right, your baby is 9 months old, no rashes. They fell today. Why did you allow a baby to fall? Baby should not be falling. No, baby should not be falling. I don't like to hear my babies are falling. Okay. Mothers, please, when the baby start crawling, when they start sitting, you got to have eyes on them 24/7. I know it's hard, but you got to have eyes on them, and we've got to have make our rooms, our houses child proof and child safe. Honestly, it's very, very important, because I know a lot of mothers will take this fall very we take it as something, it's just normal, children fall. No, for babies, it's serious, because their brain is still growing. So the first 5 years of life, the brain is one organ that is not yet fully formed. It's an organ that is still growing. And I am a neurodevelopmental pediatrician. That's one of my that's the specialty. So I see children who have disability, and it's always painful when you see a child was born normally, everything was fine, and they had a fall, and now the child has severe disability, and it can make a whole lot of difference in a child's life. So please, that brain is needs to be protected. It needs to be protected. And one of the way we protect the brain is not to allow the child to be falling. No, they shouldn't be falling. Let's not put them on height. Let's always make sure they're on flat floor. If somebody's on the flats, they are not going to fall. Okay. If they're crawling, we monitor them. Okay. You sometimes you may need to put them in a what's it called? a playpen, so that they can just play within a certain space. There's nowhere they're going to come out and fall. So we really need to keep an eye on the children. Let's not get distracted. If you can't monitor them, please make sure you carry them or put them in a place until you're able to monitor them. Once they start crawling, once they start cruising, you need to keep an eye on them. Let's not be putting them on the sofa, eye up. They are going to explore. They are going to try to come down and they are going to fall. So it is normal for them to do all that. But if they're already on the floor, you may need to clear your house of anything. Sometimes you just have to make the house child safe. So clear whatever you need to clear, all those your fancy chandeliers, everything. Just clear them out. Just make sure the children have flat surfaces to move around, and you got to keep an eye on them. We must monitor the children constantly. They should not be falling, because they can fall, they can hit their head, they can have head injury, they can develop disability. A lot of mothers don't see it as something to worry about, but I worry about it a lot, because I tend to be the one to see the end products of what has happened. So let's not allow children to fall. I know when they are start crawling and standing and walking at that beginning phase, they are prone to doing that. So we have to be on them all the time. As long as they're awake, you have to be on them. We can't leave them. We can't what do you call it? We can't delegate that responsibility. The children should not fall. Let's not be putting them on the sofa. Put them on the floor. Put them on a flat surface. Put a baby mat or whatever mat. Just put something on the floor, something soft, so that they can always be able to crawl and move around without falling. It's very, very important, because the brain is still growing. You need to be conscious of the fact that a child who is 5 years old and below, their brain is still developing. Any injury to that brain can lead to irreversible brain injury, can lead to neurodisability. It can lead to a lifelong change and trajectory of that child, and that is important. So please, please, and please, our children should not fall. Okay, so if they fall, they have a small swelling, you can apply ice pack, and hopefully, I hope it's no more than that. If the child fall and they are not vomiting, they are not having a change in the what we call level of consciousness, they are still conscious, they are still crying, they are playing, that's okay. Just apply ice pack. But if they are changing, they are not looking the same way, please, you have to bring them to the hospital. And you see, most of these injuries that will cause that severe head injury, they are not usually big, because the brain itself they are small babies, their brains are very fragile. So it doesn't have to be like a big fall like that of an adult. It could just be a small fall like that. So we really need to protect the children. In fact, some people buy all these helmets for the children to wear because of if they're falling a lot. But I just felt the most important thing is just to make sure there is somebody supervising the child, and don't leave them to their siblings to supervise them. A child cannot supervise a child. You, the parents, we are the one we are going to hold responsible. All right. Okay, let's move on. I hope there's nobody on Instagram. Instagram asks questions. I can't see any questions, but I will go on. Okay, Emilia, you're doing exclusive breastfeeding. Well done. Not giving anything at all. No water, no drug, no breast milk. Okay. So if they are not, if you are not giving that, then you need to pay attention to the what you are eating. So maybe you are taking so much of oil, because if it's coming from your breast, if it's coming from the breast milk, because this baby is taking only breast milk. Anything you see in that baby's stool is from your breast milk. Okay, because you've told me now that you're not giving nothing else. So that means everything you see is from your breast milk. So the only place we could have gotten the oil is from your breast milk. And that means you are the one taking too much of the oil. So just watch it for now. But I'm not worried about it. Or maybe what you are describing as oil, I don't know. Unless I say it myself, I'll be able to say. But just watch it. I won't worry about it. Is it also normal to see tiny reactions on my baby's face? Yeah, there are some rashes babies can have. If you go to our Facebook, our website, you will see those pictures. I hope they're still there. We're trying to upgrade our website. So there's what we call milia. It looks like tiny white dots on the baby's faces. It's normal. It's one of those normal rashes in babies. You don't need to do anything about it. We also have what we call malaria. Malaria is like it's basically itch rash. So you just like, especially if you're over covering the baby, they can have itch rashes on the face. Again, you don't need to do anything. You just need to reduce the covering. Please, let's know that it's not compulsory babies have to be fully newborns. I know we come from culture where it's as if newborns must not have any hair at all blow on them. They are going to catch cold. All those ones are myths from our grandparents and all that. That's not true. So dress the baby according to the weather. So if the weather is warm and hot, you don't need to cover them. You don't need to put cap and mittens and socks. No, let them be in a light cotton wear. Of course, if the weather is cold, then you can put the socks and the mittens and the cap. So you just use I know you are very sensible parents, just use your judgment. So sometimes I feel that most mothers in Africa, we overwrap our babies, and that's why they always have itch rashes and all that. So that's another thing. And also rashes can also come from the products we're using. Some of our products, all those nice smelling products for babies, some of them, they smell nice, but they actually give babies rashes because all those chemicals that make them smell nice, some babies are sensitive to them. So I always say parents, use natural products, your Vaseline, pure Vaseline without any perfume, your olive oil, pure olive oil without perfume. Unless you want to go and use other product like your Sebamed and all those, just use something that is hypoallergenic, something that will not give the rashes. Your coconut oil is also good. Those are natural products generally are good to go. So yeah, you're using Sebamed and coconut oil. Okay, that's fine. Yeah, those sounds okay. So it could be one of those normal kind of skin rashes, but the best option is if you post this on our Facebook group, you post a picture and I can see it. It's difficult to answer questions on rashes without seeing it. Some things we just have to see. And one picture is worth 1,000 words description. So let's see it. If you are able to get to our Facebook group, just post it and I will answer that. I was also cleaning him until his cut fell in 6 days. Is it okay to start bathing him 3 times a week? Okay, then the other days, yeah, it's up to you. I don't know where you are living. Are you living in UK? Are you living outside the country? Are you living in Nigeria? So for me, in Nigeria, our weather is quite humid, it's quite hot, and like I said, most mothers are overcovering baby with sweating and all that. So for us, it's okay to bath the baby once a day. It's fine. You bath the baby every day once a day. But for those who live in countries where it's quite cold, in Western countries, and even though most places now is summer anyway, so it's okay. But if people who live in very cold, chilly environments, yes, they can bath the baby maybe 3 times a week. It's all up to you, really. There's no hard and fast rule, So it's whatever works is fine. If you want to just clean the baby, at least just make sure at least you bath the baby once or twice a week. But if the baby is in a hot area, that once a day is fine. Okay. All right. So just use your judgments depending on where you live. Okay. Congratulations. All right. So for first time mom, I have the products on first time mom companion that answer all these questions because I know you're not a first time mom. I remember you told me that, but newborns, all the questions, there's a companion book, which is something you may find all those questions, 500 questions that mothers ask about babies. We have it as well. All right, our time is up. I'm going to go, but I just want to. I was talking about when do you take babies to the hospital. I was talking about airway. I talked about breathing difficulties, child who is bleeding, child who is having convulsions, child who has burns. These are emergencies. Take our children to the hospital immediately. Maybe another time I will finish it off. I just think my time is up right now. So thank you so much for those who have joined me today, Emilia, uh, Abisola, and Cynthia. Thank you so much. At least it's always good to have people on the other hand asking questions. Otherwise, there's no point. And those who join on Instagram, Tare, and the rest of them. Yeah, thank you so much. All right. So if you still have questions, the live session is going to be over in another 1 minute. But if you still have any questions, remember that you can always post your questions on our Facebook group. Okay, our Facebook groups. They are open from Mondays to Saturdays. So feel free to post your questions and I will be there to answer your questions. Not only me, my colleagues, our moderators will be there to answer your questions Monday to Saturday. And if you want to read about any of this topic, like I said, we've written on all of them. Check out our website. Or if you also want to follow us on all our social media pages, we do post a little bit of some of this information from time to time. And so just to remind parents. And if you have any particular topic you say, oh, I want you to talk about it, feel free to send us a DM or something, and then we'll try and deal with them. I've not really been doing like teaching for a while because I know it's difficult for people to join online all the time, but maybe I'll resume that soon. But feel free to send us a DM or contact us on any of our platform on WhatsApp and just let us know. Can you please talk about this topic? And then we can also deal with them in future episodes. So thank you so much, everyone. Have a wonderful rest of your week. July is our ATP anniversary, so watch out for all the activities that will be happening. And of course, in August, we start with breastfeeding week. So again, watch out for all that. Have a wonderful, wonderful evening, and it is bye from me. Bye bye.